Good morning, everybody. This is Shane with the Counseling Center of New Smyrna Beach. Today we're going to be talking about the topic of depression. Depression is something that has been a question for many doctors, therapists, and patients for a very long time, only in the sense that it oftentimes is a misunderstood diagnosis. Back when I was in undergraduate school, I started in 1987, and it was around that time that depression really became at the forefront of behavioral health. And essentially what happened was that very same year, an interesting drug was released, and this drug is called Prozac. Well, Prozac sort of revolutionized the industry when it comes to antidepressant medication. Before that, we had what were called tricyclics, and tricyclics were drugs that were relatively risky to prescribe, and if a patient was to take a lot of them, there was a potential for suicide or for death through overdose. And so there was a big push in order to find a medication that could treat people who were depressed, but that they really couldn't overdose on, and Prozac sort of fit that bill. But before we go into the history of depression and some of those kinds of things, what I want to do is just read to you some of the criteria from what is called the DSM. This will be from the DSM-V, which is the newest version of the Diagnostic and Statistical Manual for Mental Health Disorders. And what I'm going to do is read you the criteria just straight from it for about a minute from the DSM-V on a major depressive disorder. Now, what the DSM says is that it requires at least five or more of the following symptoms. There is approximately 9 symptoms that could qualify somebody for having major depression. Now, if you look at the ads that are all over television, what we see is that if you experience this and if you experience that, call your doctor. Of course, these are directly motivated through economic gain. So what I'm going to do is just sort of go through the list. And again, you have to experience 5 or more of these 9. And by the way, in order to qualify for a major depressive disorder, one of these symptoms has to be depressed mood, and one of these symptoms has to be loss of interest or pleasure. So in other words, to really qualify, one of the first 2 symptoms must be met. Depressed mood, by the way, means that you are depressed most of the day, nearly every day, as indicated by either a subjective report or other people's reports made about you. In other words, if you're a child or an adolescent, maybe the parent or maybe your spouse sees that you're just grossly depressed. Of course, depressed mood means that we're feeling sad, empty, or hopeless. The second criteria is what is called marked diminishment in interest or pleasure of it all or almost all activities most of the day, nearly every day. So essentially what happens is you just don't want to do anything. You really don't care. Clinically, this is what we call anhedonia. And anhedonia is simply I don't really have a pleasure or find interest in doing something that I used to enjoy. So say that you used to enjoy hiking or surfing, and now the waves are up or there's a great trail that's been released in your neighborhood. You have no desire to go do that whatsoever. That is a form of marked diminished interest in something that previously gave you some degree of pleasure. The third is significant weight loss when you're not dieting, or weight gain, meaning the change of 5% of your body weight, again, without dieting, or a decrease or an increase in appetite nearly every day. So we have an appetite increase or decrease that leads to a change of about 5% of your body weight. And there's really no reason. In other words, I wasn't intending to put on weight, or I'm not using weight loss medications in order to lose the weight. The fourth criteria is what is called insomnia or hypersomnia nearly every day. Most people know what insomnia means. Insomnia has 2 different classifications. There's what's called initial and partial. Initial means I have a hard time getting to sleep. Partial means I have a hard time staying asleep. Many people suffer from both. Some suffer from one. But hypersomnia is I sleep too much. Maybe I sleep 10, 11, 12, 15 Some of my patients have slept up to 18 or 19 hours a day. The fifth criteria is what is called psychomotor agitation or retardation, meaning that essentially you have subjective feelings of restlessness, or you're really slowed down. You just have a hard time getting going, or you just have this inner agitation. The sixth criteria is fatigue or loss of energy nearly every day. The seventh criteria is feelings of worthlessness or excessive or inappropriate guilt nearly every day, not merely self-reproach or guilt about being sick. The eighth criteria is a diminished ability to think or to concentrate, or indecisiveness nearly every day, either by subjective account or as observed by others. And the ninth criteria is recurrent thoughts of death or recurrent thoughts of suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing that suicide. It's important to note that the one key feature that many people don't talk about as we begin to look at the criteria for being diagnosed with a major depressive disorder and any other behavioral health or psychiatric, psychological disorder, by the way, is simply this, that these symptoms cause marked impairment or distress in a person's social, occupational, or other important areas of functioning in their life. This sort of idea of marked distress or impairment is pretty significant when we make this criteria. You know, some people have never really had a lot of energy. Some people have always sort of been obese. Some people, there's a lot of people who might fit a couple of these criteria, but it really isn't a significant change in their life. That being said, in order to meet the criteria for depression, you have to kind of fit these particular 9, and at least 5 of those 9, which is a little over half, and meaning that the first 1 or 2, this sort of marked depressed mood or diminished interest in previously pleasurable activities, that those particular criteria have to be met. Now, one of the things that I want to do is I want to talk about the changes that I've seen in the practice over the years. As I said, I entered undergraduate school in psychology back in 1987. And at that time, depression was sort of like on the rise, if you will. And people who were depressed typically were in treatment for depression because they were acutely depressed, as we call it, or maybe they were catatonically depressed. They didn't function at all. For them, being depressed meant that when they woke up in the morning, they woke up fatigued. They had no clue as to what they were going to do that day. So they got up, they got out of bed, maybe they went to the bathroom, and they promptly went back to bed and stayed there the rest of the day. They had no social interactions, they didn't do anything. And then in 1987, Prozac was introduced. Now, Prozac is a great medication, don't get me wrong. It's still very valuable in the psychiatric field. And this isn't an attempt to bash Prozac at all. It's just sort of showing you this sort of shift of the culture of depression. So in 1987, very few people really, I mean, there were people who took antidepressants, but with Prozac specifically, it was introduced in 1987. And they did an amazing job at marketing this medication. And by 1989, there was 65,000 prescriptions, or 65,000 people who were taking Prozac at the time. And that was within a 2-year period. So they went from a release of a medication, having nobody taking it, to 65,000 prescriptions within 2 years. Now, within 5 years' time, there was 4.5 million Americans taking Prozac, or what is also known as fluoxetine. In 5 years, they went from 0 to 65,000, then to 4.5 million within 5 years. Now, that is a significant increase. It's an unbelievable increase, actually. Now, fast forward to the latest statistics, which I have, which are from 2010. And in the year of 2010, there were 24.4 million prescriptions of Prozac given a year. That's a phenomenal rate, by the way. And the reason for this is because there has been this incredible shift in perception of the disease of depression. Now, just a disclaimer, all of this particular area that I'm going to talk about is my own personal view as a therapist. Many of you might agree, many of you might disagree. If you disagree, please write it, respond to me. I do appreciate those responses. This is just my personal opinion, and I want to talk about what I've seen as a cultural shift in depression for a few minutes. So again, this isn't like a ironclad rule. This is just my perspective on it. And what I believe happened was that through the evolution of the disease, and especially through the evolution of the use of antidepressant medications, people began to notice a shift. And that shift was that depression went from something that greatly impacted or greatly impaired, as we talked about at the end of criteria, this sort of clinically significant distress in somebody's life, to, well, I really just don't feel that well. I feel more like Eeyore. There's this cloud over my head, or maybe there's some things in my life that I've actually need to address, but I don't want to. So what they do is they go to their doctor and they ask for a prescription of antidepressant medication. The doctor, of course, asks them a few questions, and they tell the doctor, well, I've been depressed, I've been anxious or psychomotor agitation, I haven't had a whole lot of energy, I've had trouble concentrating. And then the doctor says, well, here you go, here's a medication for your depression. Well, this shift in perception of how we're supposed to feel has really made the word depressed somewhat of a generic word. Prozac continues to be to this day a word that is used as the sort of generic for antidepressant medications. Much like Kleenex is for facial tissues, Prozac is for antidepressants. And the reason is because they did an absolutely fabulous marketing job when they first introduced the medication. There's a plethora of other medications on the market for antidepressants, SSRIs, SNRIs, all these different medications. But again, Prozac became sort of the generic term for depression. And it would be before Prozac that if you were feeling depressed, you probably wouldn't have sought help for it. You probably wouldn't have talked to anybody about it. You probably would have just sort of stood back and dealt with it, as they used to say, just sort of pull yourself up by your bootstraps. Now, because of the way that Prozac was marketed, and if you guys remember, there was books that were written like Prozac Nation, all these different things, and it really became a celebrity pill to where people just started to talk about how amazing Prozac was, how it would take you from being a person who's sort of quiet in social settings, and now you would become this sort of loquacious, talkative person, and now you would be outgoing, and if you had inhibitions, it would help to minimize those. If you were having trouble with dieting, it would help with that. If you felt anxious, it would help with that. And while all of these are probably relatively true about the medication, that wasn't the reason for its prescription. The prescription for Prozac as a selective serotonin reuptake inhibitor, or SSRI, is for the treatment of major depressive disorder primarily. And that's what we're focusing on today. Sometimes it is prescribed for other things, but specifically today we're talking about its use as for an antidepressant. And what happened was the culture around us began to interpret life events or things that happen to us in everyday life as depressive. And the term depression took on this sort of generic term. I've heard 6-7-year-old kids tell their parents, I'm depressed, when they're really not depressed, they're just not doing well in school. I've had many patients come in and they're going through maybe a divorce, or they've lost somebody in their life, and they use words like, I'm depressed. Are they symptomatically depressed? Of course they are. The answer is yes. Are they truly depressed? The answer is no. They weren't depressed a year ago, and they probably won't be depressed 5 or 6 months from now. It's just that during this transitional time, or this time of adjustment, they are experiencing some short-term symptoms of depression, or clinically what we would probably diagnose an adjustment disorder with depressed mood versus a major depressive disorder. And one of the things that has happened is we began to prescribe these medications at a phenomenal rate. Again, 24.4 million prescriptions given in America alone, by the way. These numbers are all in America. This is not worldwide. This is just in America, just for this one medication. And what happened was we began to prescribe these as sort of a cure-all for people's depressive issues. And with that became this sort of cultural shift where when I'm feeling anything, when I'm feeling hurt, when I'm feeling pain, when I'm feeling emotional distress, when I'm having anxiety, when I'm feeling socially inept, whatever these things might be that people seek treatment for, that now I'm called depressed and I'm going to begin to take a medication that's going to create that change. And the truth is, it just doesn't do that. Because what we're not treating is depression. Sometimes what we're treating is social anxiety. And the only way to truly cure that is through cognitive behavioral therapies. If you read any of the literature for use of SSRIs, the other thing you're going to read about is what is called cognitive behavioral therapies, also known as CBT, or cognitive therapies, which is, because as a therapist, the hard part is getting people to actually do the stuff that we talk about in the therapeutic environment. But with this shift, again, we can see that many people began to think about depression as a means of, there's something going on in my life and I want to get help. Unfortunately, instead of seeking the real help that they need, which would be dealing with the process of whatever's going on, what's happened in America is we've turned to a pill to give us relief. Now, that isn't such a horrible thing. As a therapist, oftentimes when somebody's in a adjustment issue, I will recommend to the doctor that they get placed on an antidepressant medication, sometimes an anxiolytic medication as well, in order to help them for a brief period of time. Again, if their symptoms are causing clinical distress in their life or clinical impairment. I'd rather have a person put on a short-term regimen of medication than lose their job or fall apart or end up hospitalized. It's a much more therapeutic intervention, but it isn't something that we should just sort of go for, because there's also all kinds of side effects and things like this that really we need to begin to look at in the field of behavioral health. So I just wanted to sort of talk about that today and encourage you guys that if you are seeing signs of depression in your life, one of the best things you can do is not pay so much attention to the little fill-out sheets you might see online, or the advertisements on TV that say, if you're experiencing these symptoms, please talk to your depression. There's all kinds of fun rating scales that are out there and things that you can do, but what you really need to do is to go in and to talk to somebody about what's really going on in your life. More than likely, what you're going to see is that you have a significant issue, and that issue is what's creating the depression, and that issue probably has been in your life for a while. And what we want to do is to help you to recover from that by giving you the tools that you need in order to have a happy, healthy, and satisfying life. There's a lot of other information that I've written about this topic on our website, www.ccnsb.com. If you look on the right-hand side of that page, you'll see it there as depression. There's all kinds of other ebooks that we have available to the public for free. And if you have any questions, thoughts, or comments, please feel free to post them here. And if I can be of help at all, or any of the other 10 doctors or providers we have in our office, please feel free to call us. I hope you've enjoyed this video. I hope it's been informative, and I look forward to talking to you next time.